Hi, my name is Dr. Jeff Dugas, and I'm an orthopedic surgeon specializing in sports medicine. My practice is in Birmingham, Alabama at Andrews Sports Medicine and Orthopedic Center, and I'm a board member and fellowship director at the American Sports Medicine Institute here in Birmingham. As a sports medicine physician, we end up working with athletes in all sports, at all ages, and all levels of competition. And unfortunately, injuries of all sorts are part of every sport. In particular, we have an interest in the injuries that occur in contact sports, but even some non-contact sports have high injury rates. Some of the most concerning injuries that are on the rise right now are brain injuries that we used to call concussions, and still do call concussions, but now may be called traumatic brain injury as well. TBI is the new term for concussion. Concussions can be caused by contact sports, can be caused by non-contact sports. But either way, they are serious injuries that need to be addressed, and we're recognizing more frequently how important it is to diagnose these problems early on and oftentimes to prevent the next injury. The brain has the potential to heal and has an amazing capacity to heal, but only if the injuries are recognized and a second injury is prevented. A second injury stacked on top of the first injury can cause some of the worst results in concussion management. We've worked with a company called Archetype recently, and we're involved in some research here at ASMI and at St. Vincent's Hospital here in Birmingham, where we're reaching out to high schools and college level athletes as well as lower level athletes and even up to the pro level with a new technology called PlayerMD. PlayerMD is a sensor device. It is an accelerometer, which is a device that measures angular velocities. And we can place this inside the helmet and even on the skull of athletes. This is true in football, lacrosse, it'll be true in women's and boys soccer, even cheerleading and other sports where concussions can occur. We'll be able to place these very, very small, almost indiscernible sensors on the heads of these athletes and be able to measure the impact at the time of a head contact, such as in football. This information and the amount of energy that the head absorbs will immediately be sent wirelessly to a device that could either be on the sideline or even to a smartphone where we could know exactly how much energy has been taken up by a hit or contact with the head. We hope in the future to be able to tell what level of impact could cause traumatic brain injury, even the lowest level, and thereby be able to detect these injuries sooner and prevent worse injuries. We don't expect PlayerMD to be a diagnostic tool so much as it is kind of an early warning tool. It's a first response kind of a tool. But this is going to be an important tool in the management of concussions and TBI and is the first such device that's going to be available to the public to be used on athletes. This is something we're very excited about. Obviously, from a research standpoint, we'll be able to know more about TBI and concussions and be able to evaluate these athletes better and to be able to get a more thorough understanding of exactly how much energy their brains have taken up. And it'll also hopefully allow us in the future to be able to set a threshold to say, beyond this threshold, maybe it's unsafe to continue with contact sports either at this particular time or in the future. Those are still things to be determined, but this particular device, this PlayerMD device, is really going to revolutionize what we know and understand about such a terrible problem that certainly seems to be on the rise. So look for good things coming from Archetype and PlayerMD, and we look forward to doing that research here at ASMI in Birmingham. Thank you.